A happy new year, everybody! The beginning of a new year always is an opportunity to set new goals for establishing or maintaining sexual and genitourinary health. So here's some training advice for you. In this video, I will outline what strength training does for your body and also demonstrate a couple of exercises which are excellent even for seniors, although they may not look this way. However, before you engage in any form of exercise program, you should speak to your doctor first to find out about your personal risks and get a personal training plan. But generally, heart disease, arthrosis, and so on are no reason to not start with exercise. Even in cancer, it is very important to train regularly. Research has shown that physical exercise has the potential to lower disease-specific mortality quite substantially. The Health Professionals Follow-up study with over 51,000 participants showed a reduction in cancer-specific mortality in prostate cancer of 61% with 3 or more hours of vigorous physical activity per week. Okay, what does exercise mean? When I talk to my patients about it, I very often find out that physical activity guidelines are heavily misunderstood. Aerobic training is overemphasized. Strength training is neglected. The resistance level is too low in most. But on the other hand, the effects of very light training are hopelessly overestimated. So why should you start with a strength training program in the gym? These are the benefits. Less overall inflammatory response of the body, less risk for developing diabetes, and should you be a diabetic already, more stable blood sugar levels. Then there is increased bone health with protection from osteoporosis, healthier tendons and joints, and less overall pain. Better overall muscular function and strength not only protect from injuries and falls, but the best part is muscles are metabolically active organs. As a result, you will sleep better and your overall well-being will increase. Genitourinary and sexual health cannot be viewed isolated from the rest of the body. So basically, what is good for the cardiovascular system is also good for the bladder, the penis, and the prostate. The same modifiable risk factors apply to this part of the body. Some of you might be amazed to find out that strength training provides improvements for cardiorespiratory function comparable to aerobic exercise alone. The effects are even better when combining strength training with endurance training. Among others, strength training is very good for vascular health. It increases blood perfusion, something we are looking for to treat erectile dysfunction. Did you know that resistance training may have substantial benefits for your blood pressure? So let's talk about the workload. First, you have to be familiar with the repetition maximum as a means to define maximum strength. It's the weight you add to an exercise that allows you to perform the exercise exactly one time and not more. That's your maximal strength, equaling 100%. A suitable resistance program, also for older adults, will be based on intensities of 70 to 85% of that maximum. You would go for large muscle groups in compound exercises. If you can perform more than 6 repetitions, the resistance was too light. Do 3 sets for each exercise and go to the gym 3 times a week. When do you start? Today. When do you stop? Never. So let's have a look at some of the exercises. Squats are a must because they are one of the essential compound exercises. They not only strengthen the legs and glutes, but are also important for the pelvic floor and thus for erectile function. Don't do them on your own if you've never trained that way, because a weak spot, especially in barbell squats, is the lower back. So you will need some instructions from a personal trainer to begin with to avoid injury. Get acquainted with the movement first and master it before you start with weights. This applies to all exercises. Kettlebell squats single leg are a very good variation. Also here, you will have to take care of your back. Try to lower your butt as much as possible to get training over the full range of motion. Deadlifts are another very important exercise. It is important to keep close contact between the bar and your body to eliminate stress from your back. Also here, do these without weights first. Chin-ups are a very good pulling exercise. If you can't do them, get some help from a super band or use a machine where you kneel on a tray to take off some of your body weight. The bench press is a classic. Lower the bar onto your chest and pay attention not to arch your lower back to cheat the weight up. Presses may also be performed with your own body weight, doing push-ups or using a suspension trainer. A TRX band is very handy when it comes to the antagonistic pulling maneuver. There is an abundance of exercises. Leave a message in the comments whether you want to see more of this kind of video, so I will be creating more training stuff. Thanks for watching. Bye bye.